Have you ever searched for type 2 diabetes explained and ended up more confused than before? Maybe you saw medical diagrams, numbers, and terms like hyperglycemia, beta cells, or insulin resistance. But no one took the time to break it down in a way that actually makes sense. So today, you're going to get a real type 2 diabetes explanation. Clear, simple, visual. Because once you understand how it works, really understand, you'll never look at your symptoms, your food, or your numbers the same way again. Let's begin with what happens in a healthy body. Every time you eat, your body breaks down carbohydrates, especially sugars and starches, into glucose. Glucose is just another word for sugar, and it's your body's main fuel. It travels through your bloodstream looking for cells to enter, so it can be used for energy. But your cells don't just let glucose in. They need a key to unlock the door. And that key is insulin. Insulin is a hormone made by your pancreas, an organ that sits behind your stomach. Its job is to escort sugar out of your blood and into your cells. Think of it as the delivery service that gets energy where it's needed. In a healthy person, this system works smoothly. You eat a meal, your blood sugar rises, your pancreas releases insulin, the glucose gets absorbed by your cells, and your blood sugar returns to normal. Now here's what happens when type 2 diabetes develops. Over time, especially with poor diet and lack of movement, your body is exposed to repeated blood sugar spikes. That means your pancreas has to release more and more insulin to keep up. Your cells begin to get overwhelmed. They stop responding to insulin like they used to. This is called insulin resistance. Imagine you keep ringing the same doorbell over and over. At first it works, but eventually, the person inside stops answering. That's your body with insulin. The pancreas keeps shouting, but the cells stop listening. So now glucose stays in your blood longer. Your blood sugar levels remain high, even hours after eating. The pancreas, in panic mode, starts producing even more insulin. But it's not enough. This constant tug-of-war leads to chronically elevated blood sugar, a condition known as hyperglycemia. And that's the hallmark of type 2 diabetes. But what's really important to understand is this. Type 2 diabetes isn't just high blood sugar. It's a complex metabolic condition that affects almost every organ system over time. Your eyes, your nerves, your kidneys, your heart, even your brain. When glucose stays in the bloodstream for too long, it acts like a corrosive substance. It damages blood vessels. It triggers inflammation. It interferes with how your body repairs itself. And all of that starts from this simple breakdown between insulin and your cells. So let me say it again clearly. This is type 2 diabetes explained. Your body still produces insulin, but your cells no longer respond to it properly. This leads to a buildup of sugar in the blood, which causes damage throughout the body over time. Now, one of the most common questions people have when they first get diagnosed is this. Why me? Why is my blood sugar suddenly high? I haven't changed anything. I don't even eat that much sugar. And that's a fair question. Because the development of type 2 diabetes is often slow and silent. It doesn't happen overnight. It can take years, even decades, of subtle imbalances. Slight weight gain, slight fatigue, slight sugar cravings, and most people don't realize anything is wrong until a routine blood sugar test shows abnormal results. By the time someone hears the words, "You have type 2 diabetes," their body has already been struggling in the background for a long time. And here's another important point most doctors don't emphasize enough. Not all sugar is the enemy. Your body needs glucose to function. What matters is how that sugar is delivered, how quickly it enters your bloodstream, and how well your cells can handle it. This is where concepts like glycemic index, insulin resistance treatment, and diabetic diet meal plans come into play. But we'll explore all of that in the next blocks. For now, what you need to remember is this. Type 2 diabetes is not a failure. It's not because you're lazy. It's not because you cheated or lacked willpower. It's because your body has been under pressure for too long, and it's trying to tell you that something's out of balance. But here's the good news. Because this condition developed over time, you also have time to reverse it. or at the very least, control it naturally. Yes, that's right. In many cases, especially in the early stages, type 2 diabetes can be reversed, not just managed, through the right combination of food, movement, and metabolic support. We'll get into the science of reversal soon. But before we do, we need to understand what causes this breakdown in the first place, beyond just eating too much sugar. Because the real causes are deeper than you think. And once you see the full picture, you'll realize how powerful your next choices can be. Let's go there now. Now that you understand what type 2 diabetes actually is, a breakdown in how your body responds to insulin, let's talk about the real reasons this happens. Because most people have been told a half-truth. It's just about sugar. But the full picture is more complex and more hopeful. Yes, consuming too many processed carbs and sugary foods over time is a factor. But type 2 diabetes doesn't develop from one donut or one bad day of eating. It's a result of multiple forces working together, slowly disrupting how your body handles energy. The first and most powerful force? Chronic overexposure to insulin. Every time you eat carbohydrates, especially refined ones, your blood sugar rises. In response, your pancreas releases insulin. If you snack all day, sip sweetened drinks, or have high-carb meals regularly, you're sending that insulin signal constantly. Over time, your cells become numb to it. Just like how a strong perfume disappears after a few minutes, your cells stop responding to insulin's smell. This is what we call insulin resistance. But diet alone doesn't explain it all. Let's talk about another major driver: visceral fat. Visceral fat is the fat stored deep inside your abdomen, around your liver, pancreas, and intestines. It's different from the soft fat you can pinch. Visceral fat releases inflammatory chemicals that interfere with insulin signaling and worsen blood sugar levels. Even people who appear slim can carry dangerous levels of visceral fat. That's why type 2 diabetes isn't just about how much you weigh. It's about where fat is stored and how your body responds to it. Another overlooked factor: lack of muscle activity. Your muscles are the largest glucose sink in your body. When you move, your muscles pull sugar out of the blood, even without insulin. But if you're sedentary for most of the day, your muscles stay inactive. The sugar lingers in your blood longer. Over time, this contributes to fasting blood sugar staying elevated. Then we have chronic stress. When you're under pressure, emotionally, financially, or physically, your body releases cortisol. Cortisol increases blood sugar as part of your fight or flight response. But in today's world, many people live in a state of low-grade, constant stress. That means elevated cortisol all day, pushing blood sugar higher and higher, without you even eating anything. Poor sleep works the same way. Even one night of bad sleep can spike insulin resistance the next day. Now imagine months or years of restless nights. It's like sending your body into metabolic chaos every single morning. We also can't ignore environmental toxins, things like pesticides, plastics, and endocrine disruptors that accumulate in the body and interfere with insulin signaling. While harder to measure, research is starting to show strong links between these toxins and type 2 diabetes risk. And of course, genetics do play a role. If you have a parent or sibling with diabetes mellitus, your risk goes up. But here's the truth: genetics load the gun, but lifestyle pulls the trigger. What's empowering is that lifestyle also holds the key to reversing it. But before we get there, there's another factor we need to explore, and it often goes undetected for years: prediabetes. Prediabetes means your fasting blood sugar levels are higher than normal, but not high enough to be diagnosed as diabetes. It's a warning light, a signal that your metabolism is under stress. What's scary is that over 80% of people with prediabetes don't know they have it. They feel fine. They function normally. But inside, their cells are already struggling. That's why early testing matters, especially if you notice high sugar symptoms like fatigue after meals, frequent thirst, blurry vision, or brain fog. Doctors often use a blood sugar test called HbA1c, which gives you an average of your blood sugar over the past 2 to 3 months. A healthy level is usually under 5.7%. Between 5.7% and 6.4% is prediabetes. Above 6.5% is considered type 2 diabetes. But here's the thing. You don't need to wait for a diagnosis to take action. By the time your blood sugar is out of range, your body has already been struggling for years. Taking steps now, even small ones, can prevent damage, reduce insulin resistance, and set the stage for reversal. And that brings us to the heart of this video. Understanding the cause isn't just about information, it's about empowerment. Because when you realize that type 2 diabetes doesn't come from a single mistake, but from years of small stressors, you also realize that you can undo it the same way, one step at a time. We're not here to blame. We're here to understand. Because when you understand, you can act. And when you act, consistently, intelligently, the body responds. In the next part, we'll look at the signals your body gives when blood sugar is out of balance. You'll learn to recognize the symptoms of diabetes, spot the red flags of hypoglycemia, and understand how complications like diabetic neuropathy and retinopathy develop. It's time to tune in to your body, because the signs have always been there. Type 2 diabetes often starts quietly. You might feel fine, maybe a little more tired than usual. Maybe you're thirsty more often, or you get up to pee in the middle of the night. But nothing that screams, "Hey, something's wrong." And that's exactly why type 2 diabetes is so dangerous in its early stages, because it can go unnoticed for years, all while slowly damaging your body from the inside out. Let's go through the most common symptoms, and more importantly, what they really mean. One of the earliest signs is fatigue, especially after eating. You eat a meal, and instead of feeling energized, you feel sluggish or sleepy. This is a red flag. It often means your blood sugar levels are staying high, because your cells aren't absorbing glucose properly. The energy isn't getting where it's needed. Another common symptom is increased thirst and urination. When blood sugar rises too high, your kidneys try to flush out the excess sugar through urine. That's why people with diabetes often pee more and feel dehydrated, even if they're drinking enough water. You might also notice blurry vision. High blood sugar affects the fluid balance in your eyes and even damages the tiny blood vessels in the retina. This is the early warning sign of diabetic retinopathy, a complication that can eventually lead to blindness if left untreated. Slow wound healing and frequent infections are also common. Cuts take longer to close. You might get more skin infections, urinary tract infections, or even gum disease. Why? Because elevated glucose weakens the immune system and reduces circulation, especially to the extremities. This brings us to one of the most serious complications, diabetic neuropathy. This condition affects the nerves, especially in your hands, feet, and legs. At first, you might feel a slight tingling, numbness, or burning sensation. Over time, it can progress to pain, loss of sensation, and balance issues. In severe cases, people lose the ability to feel injuries or wounds in their feet, which can lead to ulcers and even amputations. That sounds terrifying, and it is. But what's important to remember is that these complications don't appear overnight. They develop gradually, often starting with high sugar symptoms that seem small: headaches, brain fog, mood swings, sugar crashes, and dizziness. On the flip side, there's another condition that diabetics need to watch closely: hypoglycemia, or low blood sugar. This often happens when blood sugar drops too far, either because of medication, missed meals, or intense exercise without enough fuel. Symptoms include sweating, shakiness, irritability, sudden hunger, and confusion. In severe cases, it can lead to fainting or seizures. Hypoglycemia symptoms can be just as dangerous as high blood sugar, and sometimes more immediate. That's why diabetes management is about balance, not too high, not too low. Now, how do you know if your blood sugar is in a healthy range? One of the best tools is a blood sugar test, either through a glucometer or with the help of your doctor. These tests measure your glucose in real time, either fasting, after eating, or over a longer period, like the HbA1c test. Here's a general guide, but always consult your doctor. Fasting blood sugar, normal range, 70-99 mg/dl. Prediabetes range, 100-125 mg/dl. Type 2 diabetes, 126 mg/dl or higher. For HbA1c, normal, below 5.7%. Prediabetes, 5.7% to 6.4%. Diabetes, 6.5% or higher. These numbers give you clues, but they don't tell the whole story. Symptoms matter, patterns matter, how you feel matters. Sometimes a person's A1C looks fine, but they're already experiencing diabetes signs like constant hunger, low energy, or unexplained weight gain or loss. That's why listening to your body is just as important as reading the lab results. And here's something else most people don't realize. Type 2 diabetes doesn't affect everyone the same way. For some, the symptoms are mostly physical: tiredness, frequent urination, blurry vision. For others, the first signs are mental and emotional: anxiety, irritability, foggy thinking, or even mild depression. That's because blood sugar and brain chemistry are deeply connected. Glucose is your brain's primary fuel. When it's out of balance, so are you. So if you've been feeling off lately, if your energy crashes in the afternoon, if your focus comes and goes, it might not be just stress or age. It could be your blood sugar trying to tell you something. And the earlier you listen, the easier it is to respond. Because here's the truth: many of these symptoms are reversible. Nerve pain, vision problems, even high A1C, when addressed early, can improve dramatically. But it requires action. You can't just wait and hope it gets better. You need a plan. You need to know what to eat, how to move, how to support your body, and how to avoid the biggest mistakes that make things worse. That's what we'll cover in the next section. You're going to learn exactly how to lower blood sugar naturally, how to support insulin resistance treatment, and how to build a routine that puts your health back in your hands, starting with your very next meal. And yes, you'll see why type 2 diabetes explained is not just about understanding the problem. It's about becoming the solution. Let's get into it. Let's be very clear about one thing. Type 2 diabetes is not a life sentence. For many people, it can be reversed, or at the very least controlled naturally, without relying on lifelong medication. But to do that, you have to treat the root cause, not just the symptoms, not just the blood sugar readings. You have to address what caused the insulin resistance in the first place. Let's walk through the 6 core pillars of reversal and sustainable diabetes management. Nutrition. Feed your cells the right way. The most powerful tool you have is your fork. The food you eat either increases insulin resistance or reduces it. To reverse type 2 diabetes naturally, your focus should be on low glycemic index foods. These are foods that digest slowly and don't spike blood sugar. Think of leafy greens, non-starchy vegetables, healthy fats, lean proteins, seeds, berries, and legumes. Avoid anything that causes fast sugar spikes: white bread, pasta, sweetened drinks, refined cereals, pastries. These foods flood the bloodstream with glucose, forcing insulin to spike, and keeping your cells resistant. You don't need to starve. You just need to eat smart, eat real food, cook at home, pair carbohydrates with protein and fat to slow digestion. Focus on fiber-rich meals that keep you full, nourish your gut, and stabilize energy. Movement. Activate your muscles daily. Your muscles are your secret weapon. They burn glucose, even without insulin, when you move. You don't need to run marathons. Just start walking. 30 minutes a day, every day. No excuses. Walking after meals is especially powerful. It helps your body lower blood sugar almost immediately. Add resistance training twice a week if you can. More muscle, more glucose disposal, better insulin sensitivity. Movement also improves circulation, protects against diabetic neuropathy, and boosts mood and energy. It's non-negotiable. Timing. Use fasting strategically. Intermittent fasting is one of the most promising tools for reversing insulin resistance. When you give your body a break from food, insulin levels drop. Your cells become more sensitive again. Your liver burns stored glucose. You reduce inflammation and oxidative stress. Start simple: 12 hours of fasting overnight, then 14, then maybe 16. Don't force it. Let your body adapt. Drink water. Stay nourished. But allow space between meals. Let your system rest. Fasting can also reduce fasting blood sugar, improve HbA1c, and help with stubborn weight around the belly, which contributes directly to diabetes type 2. Sleep and stress. The silent saboteurs. You can eat perfectly and move daily, but if you sleep 4 hours a night and live in chronic stress, your blood sugar won't improve. Cortisol, your stress hormone, raises glucose levels, even if you haven't eaten. Poor sleep increases hunger, lowers insulin sensitivity, and makes you crave sugar. Prioritize 7 to 8 hours of quality sleep. Go to bed at the same time. Avoid screens before bed. Create a relaxing routine. And manage your stress. Deep breathing, journaling, nature, silence. Whatever calms your nervous system will lower your blood sugar. Without food, without pills, without effort. Supplements. Support, not substitutes. Supplements aren't magic, but they can help, when used correctly. One of the most studied compounds for insulin resistance treatment is berberine. It has effects similar to metformin, without the side effects. Berberine can help lower blood sugar, improve gut health, and reduce inflammation. Other helpful supplements: magnesium, improves insulin sensitivity; cinnamon extract, lowers post-meal glucose; alpha-lipoic acid, supports nerve function, great for diabetic neuropathy; omega-3s, reduce inflammation and support heart health. Always consult your doctor before starting anything new. But these tools can amplify your progress. Mindset, the most powerful medicine. Here's something no one tells you. Type 2 diabetes explained in medical terms doesn't change your life. But type 2 diabetes understood, emotionally, deeply, does. When you see that this condition is reversible, that every meal is a vote for your future, that every step you take, every hour you sleep, every choice you make moves the needle, that's when things begin to change. You stop being a victim. You become the solution. You don't need to be perfect. You just need to be consistent. Final mensage. So if you're still here, if you've watched this far, you're already doing more than most people ever will. You're seeking knowledge. You're taking responsibility. You're investing in yourself. And that matters more than you know. Because you are not broken. You are not hopeless. You have the power to change your story. One step, one meal, one day at a time. This is your wake-up call, your second chance, not just to manage type 2 diabetes, but to take back control of your body and your life. If you want to discover how thousands of people are lowering their blood sugar naturally every day, check the link in the description. That resource could change everything. And if this video gave you clarity or hope, give it a like, leave a comment, and please, subscribe to the channel. Together we're building a movement of people who no longer accept illness as normal, who choose healing, who choose knowledge, who choose action. You're not alone. Let's fight this together and win.